Pharmacy Week recognizes pharmacists in all disciplines of pharmacy, but particularly in hospitals and health systems is what we're celebrating. And it acknowledges the contribution that pharmacists make to the healthcare team. So pharmacists for years have always been the people that you go to in your neighborhood. We've been kind of tied to the pharmacy with technical tasks for many years because of the way the practice has been required to be done. But now going forward, the focus is on the clinical. So with the new technology that we're fortunate enough to be bringing in, what we will be able to do is sort of redefine the workflow and get the pharmacists out there making those clinical contributions where we'll have more interaction at the bedside, we'll have more interaction with the physicians and the nurses, and actually be present to help care for those patients.
Pharmacy Week is just a time for people to think about pharmacy and our role in the background. I know here we're appreciated, we have good interaction with docs, nurses, all the professional people, but it's just a time to step back and say, hey, pharmacy, we might not see you all the time, but you're in the background doing a good job.
You know, we have a very important role in the running of this hospital. We don't just, deliver pills. That's not all that's involved. There's a lot more to it.
Pharmacy Week we certainly enjoy because that time the focus is on us, which it often isn't.
If we're doing videos such as this, you get to show people what actually happens in the pharmacy. Most people know pharmacy for medications, dispensing, but there's other aspects, other features that go on that you don't see, such as what I do. I'm always a behind-the-scenes person, and I'm outside. Like, people are like, what do you do? Every time, what do you do? We always see you walking in the hall, or we see you talking, and this person's like, what do you do?
We definitely don't just count pills. We actually, what we do is we do verify a lot of doctor's orders that are placed via the POM system that we have. We verify that it's correct for the patient in terms of having drug allergies or the dosage is correct. If not, we contact the provider.
Well, I speak to the nursing staff all the time when I'm delivering medication. I speak to doctors on the phone often. We interact with all the other departments. We do a lot of floor stock. So we're out, the technicians are out in the hospital most of the day.
What we do here is really work closely with the doctors and the nurses to make sure that for the conditions that you have, we help recommend therapies, we sort of help monitor what they do. We are available to them 24/7 to have input on dosing guidelines, protocols. It's very much team-oriented in the hospital where the physicians, nurses, pharmacists, everyone has a role, playing to the strengths of what they are the expert in.
We do double checks. If the technician fills it, the pharmacist checks it. We match the label to the drug and then recheck it again as it's going in a bag. We sign off on it as a technician, and then a pharmacist checks it. Nothing leaves the pharmacy without being checked by a pharmacist. And then the nurses check it as they're going to administer it.
I have the best staff in the world. Right now they're kind of working under some really tough constraints because of, while we're very excited about our technology and our renovation, they're really kind of working in a very small space. So it's kind of an added level of difficulty. But they have just risen over and above. But just in general, on a day-to-day basis, I am so proud of them, and they really are what Deborah is all about. They are really part of the team, and they are some of the smartest people I've ever met in my life, and the hardest working, and they're just a great group to be around. So if I was in the hospital, I would want them taking care of me.
Came into Deborah when I was, I'd say, 24, 25 years old. Really enjoyed what I was doing, and now that I've come back, I've learned so much more. Definitely love this job.
I do work with a great bunch of people. We have a good time and we work really hard, but it's fun. I love coming to work every day.
Well, we start with great employees, and we really are lucky in the pharmacy to have people who care about the patients, and that seems to be a center-wide theme, that we care about the patients here. So we try to do our best. We have all kinds of policies and procedures where if you follow the policy and procedure, then you're pretty much assured that you're going to get it right. So we're very strict about doing things as they should be done and not cutting corners.
When I came here 20 years ago, it was the epitome of what I would want to do as a pharmacist. Everything that we do here, we're able to give feedback to improve what we do in the pharmacy, and our opinions matter. The physicians and nurses look to us for guidance, and we're appreciated here. Years ago, my father had a heart condition, and when I went to the hospital where he was, I was shocked because I just thought all care was the same as Deborah, and it's not. Deborah is the best hospital I've ever worked at.
I love Deborah.
Happy Pharmacy Week.